And so this editorial really lit the fire in a lot of people around the world to start looking more closely at the horse and dental principles and why we're doing dentistry and better ways to do dentistry. And about this same time, Floyd introduced the Trident numbering system for labeling teeth, which allowed us to use a vocabulary that everybody could understand. It had been very confusing talking about numbers of molars and premolars and deciduous and permanent teeth. And now we had a numbering system to where everybody could be talking about the same teeth well. So what's new in equine dentistry? Well, the biggest breakthroughs have been dentistry has sort of changed with veterinary medicine as it's changed. We now have better ways to diagnose disease. We understand anatomy, histology, microbiology, virology, surgical techniques, asepsis, orthopedics. We understand that stuff better than we ever have in the past. And dentistry's just sort of hooked on to all of that and progressed with that. The big thing, though, that's been done specifically for horses is we've gotten a better look at the gross and histological and ultrastructural anatomy of horses' teeth. And we understand now that they're different than small animal teeth or human teeth, and that we're starting to understand how they develop better and how disease processes develop in horses differently than they do in most other species, and how we can apply some of the things that we've learned in the human dental field and the small animal dental field and apply that to horses where it's applicable. Also, better imaging has just made this field take off. In the early 1900s, when radiology was first discovered, and we started applying it to surgical procedures in the 1950s, I don't think anybody really had any idea where it was going to go from there and what we'd be seeing today. But when I went into practice, it was a big deal x-raying a horse's head. You usually had to put the horse under anesthesia because your x-ray machine was so slow that it may take a 2-second exposure to get an x-ray on a head. And the films were not good. You didn't have good screen film where you had high-speed films and screens. And now we've gone to the point where everything's digitalized and every veterinarian has an x-ray unit in their car. So that's changed dramatically. And then with 3D imaging, MRI, CT scans, they've really changed the way that we can look inside the horse's head and reconstruct things. And that's been a huge change. So imaging has been a big deal. The other thing that when I started practice, there were no flexible endoscopes. There were rigid endoscopes, and so we used rigid endoscopes to evaluate the upper respiratory tract of the horse. But with the introduction of flexible fiber optic scopes in the 1960s, they were price prohibitive when they first came out, but veterinarians got access to those in the 70s, and it changed everything about the way we could evaluate the upper respiratory system on the horse. And now we've got oral endoscopes that hook up to digital cameras and project an image, and flexible endoscopes that we can, all different sizes, and we can go into the sinus compartments with them and look around.